Now, more than 800 doctors and nurses will be without jobs at the end of this month. The Gauteng Health Department is laying off workers due to what they say are budget constraints. Now, Chris Hani Baragwanath hospital workers staged a picket over these job cuts today. Our reporter Silindelo Masikane has been following the story. She spoke to many people today, joins us in studio. So, Slee, this is the biggest hospital in Africa. So much important work is done here. It helps so many people. Why on earth are they laying off doctors and other medical staff?
Well, that's what we're going to find out today, Sandy. We saw a picket being staged outside of the Chris Hani Baragwanath Hospital. Some 800 doctors and nurses who will basically be without a job come the end of this month. Reasons being that they were...
All right, I'm going to interrupt you. I think there might be a slight problem with your microphone. So let's just take a clip listening to one of the protesters, exactly their concerns at Barra.
We don't believe that that's an inappropriate step from government, particularly from the Gauteng Department of Health. As one of the profs mentioned, Barra is currently serving not only this community of Soweto, not only Joburg at large, but as well as other provinces. It's quite heavily burdened at the moment with the partial closure of Charlotte Matleke, servicing the other hospitals as well that are around. So, you know, for government to actually terminate the contracts, you know, it's quite insensitive, and I think, quite frankly, it's quite negligent of the government.
You know, Slee, it's so concerning because here in Gauteng we've got Charlotte Matleke Hospital, which is still not properly up and running after last April's fire. So hospitals like Barra have to take up some of that slack. We've also in the last 2 weeks heard about junior doctors at Baragwanath who hadn't been paid for 2 months, and only once there was a massive media outcry did that get rectified. And just yesterday we started hearing about bread not being available to hospital patients. We're now told that that's been sorted out. But there's some real serious concerns about management, surely, if basic things like paying your staff and your junior doctors, providing proper food to your patients are not being sorted out in time.
So, Sally, these are some of the concerns that have been raised by many of the health professionals, especially outside of Barra today, saying that it seems as though there is a lack of leadership in terms of the officials at the Gauteng Health Department, saying that, I mean, Chris Hani Baragwanath Hospital, ever since that fire at Charlotte Matleke, has had to take on a lot of the load, a lot of the caseloads. And, I mean, by basically getting rid of some of the crucial resources like doctors and nurses, that's going to put a very heavy burden on the staff that's going to be left behind. We spoke to Professor Maji this morning as well, who really said that there needs to be an overhaul when it comes to leadership at the Gauteng Health Department. Let's take a listen.
It's indicative that this hospital patients didn't have bread for the past 2 weeks. It's indicative that this hospital biohazardous material is accumulating in this hospital, and not because the management of the hospital at fault, but because Gauteng Provincial Health is at fault for not paying the vendors to do something as offer basic supplies to this hospital. So this basically tells us is that the entire Department of Health, essentially Gauteng, has deteriorated to a point where it needs to be removed from the scene because it's incapable of managing the facilities currently under its ownership. So we need to relook the model in terms of the governance of these facilities until such time that there's greater political leadership in this province to ensure that our hospitals are not destroyed completely, because we're coming very close to that point. At this way, if these 800 staff are going to be removed, be rest assured the current health permanent staff are not going to be able to cope with the demands, and you're going to find permanent staff starting to resign as well, and that is going to compound the problem.
And here's the thing, Slee. Doctors and nurses are incredibly busy people and often involved in life-saving procedures. That the fact that we've seen the gamut of hospital staff outside Africa's biggest hospital taking time out from the wards because they're so concerned with the decisions being made about who's employed, how people are being fed and how people are being paid. It is a real indictment on the Gauteng Department of Health. What are they saying?
Certainly so, and we know that they've been inundated with media requests, especially today in terms of that picket, as well as a number of those issues that have been raised in terms of salaries and food shortages at the hospital. We know that the MEC is due to make an appearance at Chris Hani tomorrow, because according to the department, there are certainly no issues at the hospital. And in their statement today, they said that the reasons for the fact that they cannot continue with the employment of these doctors who were employed in the height of COVID to deal with COVID-19 patients is simply because of budgetary constraints. But I'm sure we will have another opportunity to be able to engage the department on their statements, as well as the state of healthcare here in Gauteng.
Yeah, this is an absolutely urgent issue that has to be attended to. Thank you so much for bringing us that story today. Silindelo Masikane, our reporter, who has been at Chris Hani Baragwanath today.